Hello, my name is Chris Jacob, and I'm a first-year cardiology fellow at Ascension Macomb Oakland Hospital in Warren, Michigan. And I'm going to be presenting a case of a metastatic right ventricular mass that presented as a STEMI mimic. The authors have no relevant financial relationships. We know that ST elevation myocardial infarctions are a cardiology emergency, and STEMI cases require acute reperfusion. As they say, time is myocardium. However, mimics of STEMI can complicate accurate diagnosis. Cardiac tumors are generally rare and can arise from multiple sources. Primary cardiac tumors can be benign or malignant, and cardiac tumors can also represent metastatic disease. Our patient was a 62-year-old man with a history of stage 4A metastatic squamous cell cancer of the supraglottic larynx. He presented to the hospital with shortness of breath. He denied chest discomfort or other anginal equivalents other than the dyspnea. His initial electrocardiogram showed marked ST elevation in the inferior and apical leads, as seen below. He was emergently taken for coronary angiography, which showed widely patent coronary circulation. A troponin T level that was drawn at presentation subsequently resulted at 0.07 nanograms per milliliter. A chest CT showed an intracardiac tumor measuring 5.3 by 3.9 centimeters, predominantly at the right ventricular apex, as seen in the bottom right. This likely represents a metastasis of a squamous cell carcinoma. A follow-up electrocardiogram was performed several hours later, and this continued to show similar ST elevation. Ultimately, our patient elected for transition to hospice care, and he was discharged from the hospital. It is important to realize that metastatic myocardial infiltration can cause ST elevation. It is hypothesized that the ST elevation is a result of the interface between metastatic and myocardial tissue. This ST elevation is persistent and typically not associated with Q waves or reciprocal depression. Troponin elevation may be seen, as in our case, and this may be related to direct tumor extension and physical myocardial injury. In conclusion, in patients with cancer with EKG changes like ST elevation, you must consider cardiac metastasis as part of a broad differential. Thank you for watching my presentation.